At this very moment, as you are watching this, your own legs and feet might be whispering urgent warnings about the health of your heart, warnings that many tragically disregard. Imagine a world where over 6 million people in the United States are currently living with a condition that silently progresses, largely because they never connected their swollen ankles or consistently cold feet to an urgent distress signal from a struggling heart. What if we told you that the common image of heart failure, a sudden crushing chest pain, is often not the first sign at all? Instead, a staggering 94% of individuals completely overlook symptoms that they dismiss as merely the natural process of aging, a little bit of weight gain, or just standing too long. Could that innocent swelling in your ankle, which you blame on new shoes, or the numbness in your feet, which you attribute to sitting, actually be your heart's final desperate attempt to capture your attention before it's too late? These aren't just minor inconveniences. They could be vital messages from your most important organ, and understanding them could be the difference between life and long-term well-being. But hold on for just a moment before we dive into these critical details. If you're someone who genuinely cares about your health and wants to uncover truths that nobody seems to be discussing, make sure to click that subscribe button and enable notifications. We're here to reveal essential information, and your engagement is important. If this video deeply resonates with you, let us know by typing 1 in the comments. If not, type 0. Your voice truly matters. Today we're going to meticulously uncover 12 scientifically proven symptoms that reveal themselves predominantly in your legs and feet during the early stages of heart failure. These aren't random issues. Medical research has consistently shown an unequivocal link between each of these observations and your heart's declining capacity to effectively pump blood throughout your entire body. Recognizing even a few of these at an early stage could profoundly alter your health trajectory, possibly even saving your life. So please, stay with us, because one of the most surprising symptoms, which affects a remarkable 78% of people with heart failure, occurs almost exclusively during the night, yet nearly no one ever makes the connection to their heart. Let's begin by discussing a symptom that many simply brush off: persistently cold feet. Most people assume it's just poor circulation, perhaps a genetic quirk, or simply a need for warmer socks. However, the truth of what's happening internally is far more critical. When your heart starts to fail, it's forced to make an impossible decision: where to send the limited blood it can still pump efficiently. Your body's primal survival instinct kicks in, immediately prioritizing blood flow to the most vital organs: your kidneys, your lungs, your heart itself, and your brain. Your feet, by comparison, unfortunately drop to the very bottom of this crucial priority list. Research meticulously documented in Circulation, one of the most reputable cardiology journals, found that patients with decreased cardiac output consistently reported cold extremities as one of their earliest and most prominent symptoms. This coldness is especially noticeable in your feet because they are the farthest point from your heart, requiring the greatest effort to maintain proper circulation. What genuinely differentiates heart failure-related cold feet from normal cold feet, which typically warm up with movement or exercise, is their persistent coolness, regardless of your activity level or what you do to warm them. Patients often describe their feet feeling as if they are shivering, even when they're wearing warm socks and shoes, and the rest of their body feels perfectly comfortable. If your feet are always cold, no matter what you try, it might be a significant indication that your heart is struggling to keep up with your body's essential demands. The second symptom is something you can actually test yourself right now wherever you are. It's called pitting edema, and it's a simple test medical professionals use daily. If you've noticed any swelling in your legs or ankles, gently but firmly press your finger into the swollen area for about 10 seconds, then release. If you see a deep indentation or pit that remains for several seconds after you remove your finger, you are witnessing pitting edema. This fundamentally changes the meaning of your swelling. While standing for extended periods can sometimes cause temporary pitting edema, this particular type of fluid buildup tells a very precise story about processes occurring inside your body. Research published in the American Heart Journal has demonstrated a direct and undeniable link between pitting edema and right-sided heart failure. When the right side of your heart begins to falter, it loses its ability to effectively pump blood returning from your body back to your lungs for reoxygenation. This leads to a significant accumulation of blood in your veins, creating a massive backup throughout your system. The increased pressure then forces fluid out of your blood vessels and into the surrounding tissues, which is why when you press on it, it creates that depression. This signifies displaced collected fluid, and the fact that it doesn't quickly bounce back indicates just how saturated your tissues have become. Your body is sending you a clear warning sign that your heart isn't able to perform its most fundamental function of pumping blood effectively. The third symptom you might be experiencing is a sudden, inexplicable muscle weakness in your legs. This isn't just about feeling tired at the end of a long day. Recent groundbreaking research in circulation heart failure revealed something that truly stunned the medical community. They found that patients suffering from chronic heart failure frequently exhibit skeletal muscle weakness that severely limits their ability to perform routine physical activities. This represents a profound alteration in your muscles' actual capacity to contract and execute even the most basic movements. On a cellular level, if your heart cannot pump blood efficiently, your leg muscles simply won't receive the vital oxygen and nutrients they need to function properly. The study specifically noted that heart failure patients showed lower levels of myosin heavy chain protein in their individual muscle fibers. To put it in easy English, your muscles are essentially losing the fundamental protein machinery required for contraction. As a result, your ability to climb stairs, walk any distance, or engage in activities demanding leg strength will significantly diminish. What's even more concerning, the study found that this weakening in the muscles persists even after doctors work to improve cardiac function with medications or other treatments, suggesting irreversible changes to the muscle structure itself. If simple tasks like climbing stairs, which used to be effortless, suddenly make your legs feel like jelly, it's a strong signal that your heart may not be adequately nourishing your muscles. Next, we move to rapid weight gain due to fluid retention, especially noticeable in the lower body. Have you ever stepped on the scale and noticed you've gained several pounds almost overnight, or perhaps 5 to 10 pounds in just a few days? When this abrupt weight gain is accompanied by swelling in your legs and feet, it's highly unlikely you're experiencing fat accumulation from overeating. Instead, you're witnessing your body's desperate struggle to cope with a failing heart that cannot circulate fluid appropriately through your system. The Mayo Clinic proceedings recognized fast weight increase as one of the primary red flag indicators requiring prompt medical attention, specifically because of fluid retention. This is far more serious than merely feeling bad about the numbers on the scale. This weight gain indicates a fundamental breakdown in your body's ability to maintain normal fluid balance. Unlike the gradual weight gain that occurs over weeks or months due to increased food intake, patients have reported gaining anywhere from 10 to 15 pounds in a single week, and every ounce of that weight is retained fluid, not fat. Due to gravity, this excess fluid tends to concentrate in your lower body, causing your jeans to suddenly feel tight around your calves, your shoes to no longer fit, and your legs to feel heavy and swollen. If you experience a considerable amount of weight gain in a very short period, with the majority settling in your lower body accompanied by edema, this is a medical emergency that demands immediate evaluation. Your heart is no longer winning its fight to maintain healthy circulation. The fifth symptom you might observe is your legs developing a bluish or dusky color. Looking down and seeing your legs take on an alarming bluish or dark tint is what medical professionals refer to as cyanosis. This is one of the most visually obvious and medically significant symptoms that your heart is struggling to maintain adequate circulation throughout your body. It's not something delicate that you might easily overlook. This noticeable color change frequently causes significant concern. A study published in ESC Heart Failure identified cyanosis as a crucial peripheral symptom of congestive heart failure. Cyanosis occurs when oxygen-deficient blood begins to dominate your circulation, particularly in areas of your body where blood tends to pool or travel more slowly through your vessels. Your lower legs, ankles, and feet, being the most dependent parts of your body, are often the first to show this bluish tinge because gravity naturally pulls blood down into these areas, making it even harder for an already weakened heart to circulate blood adequately. As heart failure progresses, this discoloration becomes more pronounced and remains present throughout the day. It will often start at your toes and feet and progressively creep up your lower legs. It's typically much more evident when you're sitting or standing for extended periods, as blood pools most drastically in your lower extremities. There is no benign or cosmetic reason for this color shift. It reveals not only the desperate state of your circulation, but also a profound impact on the oxygenation of your tissues. This blue color is your body's way of signaling that a crisis is developing at the molecular level. Your cells are quite literally starving for oxygen. One of the symptoms you absolutely cannot ignore is persistent ankle swelling, which stands as our sixth critical indicator. Ankle swelling is among the most obvious manifestations of congestive heart failure and is often one of the very first warning signs patients experience. When your heart begins to weaken, it simply can no longer pump blood efficiently through your circulatory system. This causes pressure in your veins to gradually increase as blood starts to back up from your failing heart, much like traffic piling up after an accident on the highway. Research published in the Journal of the American College of Cardiology Heart Failure, JACC, not only found ankle swelling to be one of the most commonly reported early warning signs of heart failure, but also one of the most reliable indicators of how the condition might worsen over time. The increased pressure from this blood accumulation in your veins causes fluid to leak out of your blood vessels and into the surrounding tissues. Your ankles become the primary gathering point for this extra fluid because gravity naturally and relentlessly pulls fluid downward to the lowest points in your body. What makes this a particularly concerning sign, distinguishing it from occasional normal ankle swelling, is that this discomfort often does not subside with rest or elevation. It persists day after day, steadily worsening over time, and frequently becomes noticeably more obvious as each day progresses. You might wake up with relatively normal ankles, but by bedtime, they've become greatly swollen and tight. This pattern confirms you're dealing with fluid accumulation caused by heart failure, not just the temporary swelling you might get from spending a long day on your feet. If you press on the swollen area and observe the pitting we discussed earlier, where an indentation remains after you remove your finger, it further underscores this critical issue. The seventh symptom, slow healing sores on your legs or feet, vividly demonstrates how severely your circulation has been impeded. When a minor cut, scrape, or sore on your leg or foot, which would ordinarily heal within days or a week, instead persists for weeks or even months, it reveals a critical issue with circulation and oxygen delivery originating directly from your failing heart. An eye-opening study in the Journal of the American Medical Association, JAMA, shed crucial light on the profound connection between delayed wound healing and congestive heart failure. The study identified three primary reasons for the greatly delayed wound healing faced by heart failure patients: tissue hypoxia, where your tissues are not receiving adequate oxygen; reduced immune function, meaning your body struggles to fight off infections and build new tissue; and hampered circulation, preventing the essential building blocks necessary for healing from reaching the wound site efficiently. When your heart cannot pump blood adequately, your tissues suffer from chronic oxygen deprivation, and this is profoundly significant for wound healing. The healing process itself is incredibly oxygen intensive, requiring a robust blood flow to transport nutrients, immune cells, and all the building blocks to the specific injury site. The disruption of this vital blood flow, which occurs with heart failure, causes even tiny wounds to become significant challenges that may take months to resolve. And tragically, some wounds may never fully heal without vigorous medical intervention. If you have a cut, scrape, or sore on your leg or foot that has been there for weeks without substantial improvement, it is a dangerous warning sign that your heart is not delivering adequate circulation to your extremities, and you should seek medical attention immediately. The eighth symptom, leg cramps or pain while walking, significantly restricts the activities you can engage in daily. Imagine walking at a normal pace for just a few minutes, only for your leg muscles to start cramping and hurting with such intensity that you are forced to stop and rest. This symptom, which medical professionals refer to as claudication, is considered one of the most functionally limiting symptoms of congestive heart failure because it can profoundly diminish your freedom and movement. Comprehensive research published in the Journal of Cardiac Failure demonstrates a clear connection between these claudication symptoms and decreased cardiac output in heart failure patients. If your heart is beginning to fail, it simply won't be able to pump blood effectively enough to meet the demands your body places on it during physical activity, even relatively light exercise that was previously effortless. Your leg muscles, being among the largest and most metabolically active muscles in your entire body, are often the first to suffer the catastrophic effects of this reduction in blood flow and oxygen supply. Patients frequently describe progressive muscle discomfort, cramping, and exhaustion in their legs during activities that were once absolutely effortless, such as walking to the mailbox or performing light housekeeping. This is a common occurrence as heart function continues to diminish. At first, you might only experience muscular weariness during more difficult tasks, like climbing hills or carrying groceries. Nevertheless, as heart failure progresses, these symptoms begin to manifest themselves with progressively less strenuous tasks, until eventually, simply walking across a room becomes difficult. This gradual limitation clearly demonstrates how the deterioration of your heart's function is directly affecting your muscles' ability to work, as they are deprived of the oxygen-rich blood they so desperately require. At this point, we've arrived at the ninth symptom, the one that almost no one associates with the heart, yet it occurs during the night and affects a striking 78% of individuals suffering from heart failure: the annoying sensation of restless legs. After a long day, you finally make your way to bed, hoping for some much-needed rest, but your legs start to feel as though they are acting independently of you. Twitching, cramping, and an unexplainable, overpowering yearning to move make it impossible to sleep. Studies published in Sleep Medicine Reviews shed light on the fascinating and intricate relationship between fluid redistribution and the onset of restless leg sensations in heart failure patients, illuminating the exact mechanism that's stealing your sleep. When you stand and walk around during the day, due to poor circulation and constant gravitational pull, fluid from your poor circulation tends to build excessively in your lower legs and feet. As soon as you finally lie down for the night, however, this accumulated fluid starts to move and redistribute itself throughout your body because gravity is no longer forcing it downwards. This movement of extra fluid from your legs back towards your core circulation causes nerves to be compressed, alters electrolyte balances in unforeseen ways, and creates the peculiar sensations your brain perceives as an urgent, overpowering need to move your legs. This overnight fluid shift creates nerve irritation, resulting in sensations patients describe as extremely frustrating, including tingling, burning, or a crawling feeling. Because of the impaired circulation associated with heart failure, the tissues in your legs may already be having difficulty receiving adequate oxygen delivery throughout the day. This nighttime fluid shift can further exacerbate the condition, leading to a perfect storm of neurological irritation that renders it nearly impossible for you to get a peaceful night's sleep, leaving you feeling fatigued day after day. The 10th symptom on our list is the rapid worsening or unexpected appearance of varicose veins. If existing varicose veins you've had for years suddenly get significantly worse, or if new varicose veins arise seemingly out of nowhere, your body could be revealing a much more serious underlying problem than simple cosmetic vein troubles. Research published in the Vascular Medicine Journal discovered a substantial, often unrecognized connection between heart failure and the rapid advancement of varicose veins. Varicose veins develop when the one-way valves in your leg veins become damaged or compromised, causing blood to flow in the wrong direction and pool in your lower extremities rather than effectively traveling back to your heart. When congestive heart failure is introduced, an immense increase in pressure occurs throughout your entire venous system, confronting this already weakened system with an extra overwhelming obstacle that significantly accelerates the problem. This is because with a failing heart, blood begins to back up from the weakening organ, causing this pressure to build. Your leg veins and their already weakened valves are subjected to significant stress from this elevated pressure, causing them to fail more quickly and completely than they would have otherwise. Patients who previously had moderate varicose veins, considered mainly a cosmetic issue, frequently report that their condition significantly worsens over just a few months when heart failure develops. The veins become larger, more numerous, more painful, and more functionally problematic. If your varicose veins have suddenly become considerably worse or new ones are rapidly emerging, it could be a crucial indication that your heart is exerting harmful backward pressure in your venous system, and you should seek medical attention promptly. Moving on, the 11th symptom involves changes to your skin that are exceptionally noticeable if you know what to look for. When you examine the skin on your lower legs and feet, does it appear unusually shiny, almost as if it has been stretched tightly over your bones? Does it feel thinner, more delicate, or oddly smooth to the touch, different from the skin on other parts of your body? Changes of this nature are not merely superficial. Their significance lies in the fact that they demonstrate how the fluid retention caused by heart failure is essentially modifying your skin at a structural level. Research published in Heart and Lung comprehensively described these distinctive skin alterations observed in patients suffering from chronic heart failure. When fluid continues to accumulate in your tissues as a result of congestive heart failure, it doesn't just result in visible swelling, it causes fundamental changes to the structure and appearance of your skin in medically relevant ways. When you have an excessive amount of fluid, your skin is stretched beyond its normal limit, much like blowing up a balloon. While typical healthy skin has a matte appearance due to its natural texture of pores and microscopic wrinkles, when fluid accumulation causes the skin to become taut, it flattens all these natural characteristics. This results in an excessively smooth and shiny surface that reflects light differently from normal skin. This change is so consistent and dependable that medical professionals frequently use it as a visual diagnostic signal to determine if a patient is experiencing significant fluid retention. Due to the stretching affecting the skin's structural integrity, it may also appear thinner and more translucent, making it more fragile and prone to tearing or injury. Finally, the 12th symptom is the uncomfortable and persistent numbness or tingling you experience in your feet. The sensation of your feet falling asleep transitions from a minor inconvenience to becoming something you experience throughout the day, sometimes to such a degree that it interferes with your ability to walk safely and causes you to lose your balance. Most individuals underestimate the true prevalence of these neurological symptoms in heart failure patients, yet research published in Current Heart Failure Reports found them to be significant. Numbness and tingling in the feet associated with congestive heart failure are caused by two primary mechanisms that frequently interact to trigger the condition. The first process involves the direct compression of nerves occurring as a result of swollen tissue. As a result of poor heart function, fluid can gather in your feet and lower legs, leading to swelling. This swelling can compress the tiny nerves that provide sensation to your feet, causing numbness, tingling, or even sudden sharp shooting sensations. The second process, which is actually more concerning, includes a decrease in the amount of oxygen supplied to the nerves themselves. Like every other tissue in your body, your peripheral nerves require an adequate amount of oxygen to operate effectively. If heart failure limits the amount of blood flow to your extremities, the nerves in your feet may not receive sufficient oxygen to continue functioning normally. This oxygen deficiency causes your nerves to misfire, sending misleading messages to your brain, which you then interpret as feelings of numbness, tingling, pins and needles, or burning sensations. In the beginning, you might feel a slight tingling sensation that comes and goes without any discernible pattern. However, as heart failure advances and worsens over time, these sensations become more consistent, stronger, and more difficult to ignore. Some patients have reported feeling like they were walking on pins and needles during the day, while others describe their feet as feeling completely numb, as if they were walking on stumps. This can become problematic as you lose the capacity to feel injuries, temperature changes, or pressure points, which could potentially cause major harm to your feet. In our comprehensive joint investigation of these 12 essential symptoms, one truth has become utterly transparent. Your legs and feet are highly sophisticated early warning systems capable of identifying heart failure long before it becomes acutely life-threatening. Every single symptom we have reviewed today is your body's urgent attempt to convey a vital message, that your heart requires immediate medical assistance. On this particular subject, the scientific research is unequivocally clear. These are not trivial inconveniences to disregard until your next scheduled visit. They are evidence-backed indicators of an illness that is currently affecting over 6 million people in the United States and continues to claim more lives than several different types of cancer combined. However, this is the empowering truth that ought to inspire you with hope. The ability to recognize these signs at an early stage can undoubtedly be the difference between an illness that is treatable and one you can successfully live with for decades versus a medical emergency that leads to disastrous outcomes. It is crucial to remember that congestive heart failure does not always manifest with the dramatic chest pain and collapse you see in movies and on television. The majority of the time, it communicates its presence to you through the subtle yet profound changes in your legs and feet, which we have discussed in great depth today. That swelling in your ankles that doesn't go away, even with rest or elevation, is not just a permanent problem. All the warm socks and heating pads in the world won't be enough to warm up those persistently chilly feet. That unexplained increase in weight that appears out of nowhere and primarily manifests itself in your lower body. These symptoms are your body's way of pleading or even begging for assistance before it's too late. You should not wait for the symptoms to become more severe or expect that they will miraculously disappear on their own. If you recognize several signs from today's detailed discussion, meaning more than just one or two isolated symptoms, please get in touch with your healthcare professional as soon as possible. When I say that something has the potential to save your life, I am absolutely not being hyperbolic. With early intervention for heart failure, it is entirely possible to significantly improve results, enhance your quality of life, and extend your longevity. We have medications, treatments, and lifestyle interventions that work remarkably well when we catch this condition early, but they become far less effective when heart failure has progressed to advanced stages. Tell us what you learned today and what change you're prepared to make in the comments section below. Since we all grow when we share, let's help one another. If this video was helpful to you, or if it even slightly opened your eyes, please hit the like button. Click subscribe to ensure you don't overlook any crucial information that could truly alter your health, and turn on the bell before you leave. Again, please input 1 if this video was useful. If not, type 0. You might not realize how important your comment is to this community. Something truly significant has been attempting to communicate with you through your legs and feet. At this point, you are now empowered to pay attention to what they are saying. Be sure not to disregard these messages. It is entirely possible that they are about to save your life right now in this very instant. We are profoundly grateful that you have taken the effort to educate yourself on these vital, potentially life-saving signs. It is critical to keep in mind that detecting these signals at an early stage and taking decisive action on them could be the single most significant thing you do for your future health and the precious time you will spend with the people you love.